So arriving here was no small feat whatsoever, and it is a testament to your very hard work, your resolve, your collegiality, and this state, where we hear so much about artificial intelligence. I'm going to submit that this room full of Wayne Warrior MDs is testament to the human intelligence that it takes and the dedication. So round of applause for these matched students, class of 2024.
I matched at Henry Ford in internal medicine.
I'm just really excited, and I'm very grateful for my 4 years here at Wayne State, and I can't wait to continue my education and training and residency.
I matched at Mayo Clinic, Arizona. This is my number one choice.
We're excited.
We're scared and excited.
I am matched at general surgery at University of Florida.
I'm just excited. Wayne State.
Go Henry Ford. I'm so happy to be there.
Go Warriors, baby.
It was my number one choice.
And that was my number one choice.
It was my number one spot.
It was my first choice.
I matched at University of Colorado in Denver in internal medicine, and that was my number one.
Welcome, everyone. My name is Dawn Yargeau. I am from the Office of Admissions, and I'm glad that all of you are here. I want to give you a couple of housekeeping rules as we move forward. I see more people are joining us right now. Your microphones and camera are automatically disabled. If you have any questions or comments, we will try to answer them throughout. But when you put them in the chat, make sure that you change the drop down to everyone so that everyone that's in the presentation can see those. We would like, while you're waiting and we'll get started, if you want to throw in the chat, tell us where you're joining us from. We'd love to see where everyone is. And this is a series of webinars that we put on by the Office of Admissions. So if you want to learn more about our curriculum, our clerkships, community service opportunities, please visit med.wayne.edu/admissions/events to view our recent webinars on each of those topics. And now I'm going to introduce you to Kristen Copenhaver. Kristen is the Director of Admissions at Wayne State University School of Medicine.
Thank you, Dawn. Hello, everyone, and thank you so much for joining us again today. I am so excited to see all of the chat messages right now with all the locations from where you're all from joining us. So welcome, everybody. We have a full program for you today with some of our incredible faculty members, students, standardized patients. So I won't take too long, but we thought we'd give you just a quick, brief, general overview of our program and what it means to be a Warrior MD. So for those of you who are unfamiliar with us or might need a bit of a refresher, we've been around for nearly 160 years, and we've been committed to transforming the promise of equal health into reality for all ever since. We pride ourselves on learning from our internal and external communities, which makes our students more well-rounded, skilled, and compassionate physician leaders and healthcare advocates. So next slide. Thank you. Here at the Wayne State University School of Medicine, we have so many opportunities for our students to gain hands-on experience via clinical skills experience, research-based community engagement service. We have 100+ student organizations, 70+ clinical sites, 13 student-run free clinics, and so much more. And today, we're definitely going to be focusing on and featuring our Kado Clinical Skills Center. So we won't be talking in depth about any other student orgs or anything like that, but we do have webinars on that, as Dawn mentioned. Feel free to check out our webinar list in our YouTube channel. So here we have our curriculum slide. It's just a quick overview diagram of our pre-clerkship phase. You'll see our curriculum integrates classroom, self-directed learning, small group learning, clinical skills, cases, experience, and training. We have a full cadaver dissection program and are a pass-fail curriculum. Next slide. We also, as I mentioned, offer a ton of research opportunities. We're a highly ranked research institution, which means our students have direct access to so many faculty alums who are research experts, and they have access to pursue research in just about anything and everything they may wish to pursue. So our students can enroll in a M1 and 2 research elective, or they can pursue individualized and longitudinal pathways. So this slide, we also offer our scholarly concentrations in a variety of areas, including global health, population health, women's health, and so on. Next slide. And we are located in one of the best cities in the US, of course, in the heart of Detroit in Southeast Michigan, which is home to Michigan's leading healthcare facilities, provides access to diverse populations, cultures, and perspectives. Our students also have access to incredible entertainment venues, museums, sports games, matches, restaurants, and much more. There's just a palpable excitement, vibrancy here right now here in Detroit. It just continues to grow, which I believe hopefully some of you outside of Michigan may have seen via the NFL draft or the Detroit Lions and many other things happening here in Detroit. Next slide. We are Michigan's largest producer of physicians. We have 26,000 plus living alums working, leading in Detroit and beyond. As you saw or may have seen the match video that started this presentation today, we have a 98.1% match rate in 2024. We have a 98% match rate over the past 8 years. And in 2024, our students matched in 24 specialties in 30 states. Next slide. And then just to give you a sneak preview, we welcomed a wonderful class of students in July. It was our Warrior MD class of 2028. And just some stats here, 318 future Warrior MDs joined us from 104 institutions, I believe with 120 plus majors represented. So we were thrilled to welcome them from 30 states. So I think that's all I have, but we'll send out a link to this whole recording as soon as we have it available. I know I went through that really quickly, so a lot more information will be available via that link for you in the future. So thank you so much. Dawn, back to you.
So today we are welcoming you all to our OnRap series titled Clinical Skills Experience from Day One. We're known for clinical excellence at Wayne State University School of Medicine, and we're highlighting the Kado Clinical Skills Center. And one of the significant ways we provide our students with clinical experiences from day one. It's been quite a challenge to come up with a date because the Kado Clinical Skills Center is busy. It seems like 24/7, but I know it's really not. So we have some very fantastic people here. Dr. Aaron Miller, who's the course director for Segment 1 Clinical Skills. We have Dr. Daniel DeWert, who is course director for the M2 Clinical Skills course. We have Dr. Trifon Dimitrevsky, the director of simulation at the Kado Clinical Skills. And I remember when Trifon was a medical student at Wayne State. So we're glad he's still working with us. We have Kim McKissack. I hope I'm pronouncing your name correctly, Kim. She is one of our standardized patients in the Kado Clinical Skills Center. We have 2 M4 students, Alyssa and Lyal. So hopefully you get all the information you want. Dr. Miller.
Thank you so much, Dawn. Hi, my name is Erin Miller. I am the medical director of the Clinical Skills Center and also a proud Wayne State School of Medicine graduate, class of 2013. I am trained and board certified in both internal medicine and pediatrics, and currently practicing outpatient internal medicine at Henry Ford Hospital while I'm not here. So I have been with the Clinical Skills Center since 2018, first as the Segment 1 course director for the Clinical Skills course, and I took my role as medical director just this last spring. So I'm really excited to have the chance to introduce you to the Clinical Skills Center. It's this really special place here at Wayne State that provides you a wonderful foundation for your medical training. So first, I just wanted to kind of give you a lay of the land. The Skills Center is located on the second floor of the Masrick Educational Building. And you can see it takes up most of the second floor here. We have 20 patient rooms, so they're all set up to essentially kind of mirror any clinic room that you would encounter out in your practice. We also have 4 simulation labs, which Dr. Dmitrievsky is going to give you a lot more information about what goes on in the sim labs. We have classrooms, so we're able to have discussions before and after your different encounters and really provide some deeper level learning points for you. And then just multiple support rooms, including proctor stations and observation stations, standardized patient lounge. So it's a very big facility here. So we have all sorts of different simulation opportunities here in the center. And again, Dr. Dmitrievsky is going to really go through these, but I wanted to give you a sense of the fact that we have lots of different sim mannequins to give you experience working with different types of patients that you'll encounter in real life. There's also a lot of equipment that helps us to teach you how to do procedures before you get to actually trying out those procedures on real life patients. So you can practice your lumbar punctures, thoracentesis, paracentesis, all of these things. We have a robust ultrasound program with a lot of ultrasound equipment as well. And then we also have a surgical skills center, which is on the same floor. And so it's particularly students who are interested in pursuing surgical specialties have the chance to interact with some of that equipment as they progress in their training. Next slide, thank you. So this is just a couple of pictures so you get a sense of what the facility looks like. The first picture here is in the sim lab, and this is where you'll come in and do things like mock codes and other training pieces as you get a little more advanced in your training. The middle picture is one of those patient exam rooms that I was mentioning, and this is where you're going to spend the bulk of your time in the Skills Center as an M1 and M2, really learning those foundational skills as we kind of coach you up. And then I wanted to give you a sense of what it looked like out in the halls. You'll notice there are all these chairs with computer stations. So this is where you'll practice doing things like typing up a patient note, which is an incredibly important clinical skill that you'll need for the rest of your practice. And so you get a lot of opportunity to put those skills into practice as well. Next slide, thanks. So I like to highlight the fact that the Skills Center is really here to provide you with a safe space to learn those foundational skills, the critical communication skills, physical exam skills, procedural skills, and really clinical reasoning skills, learning to think like a doctor that you'll use for the rest of your career. And it's a safe space because you have a chance to really focus on learning because real life patients aren't yet in play. And so you're free to make mistakes and figure things out through your own experience. Next slide, thanks. So each level of your training here really focuses on getting you to the place that you need to be for the next level in your training. So when you come in as an M1 student, and I'll talk more about this very shortly, the focus is really to prepare you to go out into the community for your continuity experiential course and also to participate to the fullest in the service learning opportunities at some of those student-run free clinics that people mentioned in the introduction. And so you have the chance to really gain those foundational skills. In M2, the focus shifts to preparing you for your M3 clerkships. So Dr. DeWeer is going to go through talking about kind of what that looks like in practice, but you have a chance to really start to think about how the skills that you're learning translate into each of your particular clerkships. In M3, you come through as you kind of move into the M3 rotations to help orient you to those different expectations and what it might feel like to see patients in the hospital. And then some of our clerkships also bring you back through the Skills Center to hone your skills further. So you really start to build the advanced skills that you're going to need to excel in your clerkships. And then as an M4, we're really starting to shift our focus to preparing you for residency. So you'll have your emergency medicine clerkship. You'll come through the Skills Center during that time. There's also a transition to residency course that you go through at the end of your M4 year. And so we want to make sure that you're ready to meet the most challenging aspects of residency, even before you set foot into the hospital as an intern. So for Clinical Skills 1, which is what you would encounter kind of starting medical school here, first of all, you'll come into the Skills Center 10 times over your first segment of medical school. All of those sessions involve a standardized patient encounter. We're really fortunate later on in the session, I'm going to introduce one of our amazing standardized patients, but these are people who have been specifically trained to kind of reflect back the patient experience to you so that you can understand how you're doing with your communication. You can understand how effective your physical exam skills are. And then not only will you be practicing those kind of patient-facing skills, you'll also get a chance to practice writing notes, presenting a case, and then kind of learning some of those higher level clinical reasoning skills so that when you get out into the real world, you are ready to interact with patients and you are ready to really learn the medicine, because the mechanics of seeing a patient by the time you finish with this course are kind of second nature to you. This course is really intentionally integrated with your other coursework. So while you're learning the anatomy of the heart and the physiology of the cardiovascular system, you're learning how to listen to the heart and how to feel for pulses around the body. And so it really works nicely with the rest of the curriculum. As I kind of mentioned, these are the foundational skills you're going to come back to again and again throughout your career. So as long as you have a career where you're seeing patients in some capacity, you need to know how to talk with them. You need to know how to express empathy with them. You need to know how to perform basic physical exam maneuvers. It will really help to empower you to contribute during those service learning experiences. And it helps you to make the most as an M2 of your continuity experiential clerkship, where you're going out to a community preceptor and seeing real life patients as part of your M2 experience. So with that, I'm going to turn it over to Dr. Dan DeWeert, who is the course director for the Segment 2 Clinical Skills course, to give you a better sense of what that course looks like.
Thank you, Erin. Everybody hear me okay? I'm Dan DeWeert. I'm an ER doctor, and I have the privilege of teaching Clinical Skills 2. I love teaching Clinical Skills 2. This is the course that you take in your second year, right before clerkships. It's essentially a clerkship prep course, like Erin said. And the goal of this course is to give everybody the skills that they need to, essentially hit the ground running right when they get to clerkships. Clerkships are short, they're super important. You want to be a part of the team right away. You want to be integrated in the team. You want to be able to take full advantage of learning opportunities, seek out opportunities for procedures. And so early exposure helps you do that. Other goals are, to have a safe learning environment for these first clinical exposures, so you get very comfortable, like Dr. Miller said. It's fun. We've got just a great staff, lots of participating faculty. I talk with clerkship directors to make sure that everything in the course is high yield, efficient, pertinent today. So I think, people in general have a lot of fun with this course. They're pretty motivated right before clerkships start. We create basically sessions where each session represents a clerkship. It's integrated with the rest of the curriculum. So whatever you're learning about in your basic classes, the goal is to coordinate that with our focused physical exams and the specialty that we're learning about. We do specialty specific histories, notes, focused physical examinations, oral presentations, and clinical reasoning during each of these sessions. And we also have 3 sessions dedicated specifically to procedures and other adjunctive skills, like a lot of ultrasound. We're incorporating more and more point of care clinical ultrasound, also ECG monitors. We incorporated a new auscultation session with some cardiologists and a lot of other like basic high yield procedures that can really help you be part of the team right when you get to clerkships. I think the best part about this course to me is the community. I have the privilege of working with so many amazing people groups, starting with the Kado staff. who really make a safe, great learning environment for everybody. The standardized patients, some of the best that I've ever seen. They have so much experience. They're highly trained. They care so much about making you into helping you become a great physician. So it's just been a privilege to work with them. We also work with M4s. The third hour of each session is a small group with the M4, where you do your oral presentations and your notes and some clinical reasoning. And so that's kind of another opportunity for some mentorship and some community that I think people like a lot. We usually have a small procedure kind of icebreaker during that session too as a bonus. And another group of people that we bring in are expert faculty. We work with a lot of different hospital systems, and there's a ton of clerkship directors, program directors, department chairs, people practicing clinically in the community, and all locations in the hospitals who want to teach you. And it's my privilege to get to bring everybody together, and we just have these fun days. They teach the focused physical exams and some procedures, as well as ultrasounds, and sessions are just really fun. So that is what we do. I think that this is an enormous strength of Wayne. It's much more than I got in medical school. I think it preps you guys really well for clerkships. I think you get to explore your interests, your strengths, your weaknesses before you even hit clerkships, and it just helps everything stick that much more. Helps you hit the ground running and take advantage of every opportunity you get. And I think we have a lot of fun. So that's second year clinical skills too. Thanks.
Thanks so much, Dr. DeWeer. I'm going to bring on now Dr. Trifin Dmitrievsky, who is our Director of Simulation, who's going to walk through some of the really cool and exciting equipment we have here to kind of augment your training.
Thank you for the introduction, Dr. Miller. And I too want to say that I was a Wayne State student myself, like Dawn had mentioned. Boy, I started as a medical student 26 years ago, back in the 90s. Although I can boast, I guess, that I graduated this millennium. It means a lot to me to be an alum of this institution, and it meant a lot to me to participate here today. I actually was scheduled to work clinically today, and I was able to do some finagling and switch out of a shift, which allowed me to be here today. So, I have a huge not only amount of respect and pride being from this institution, but also to be able to give back and to teach. It means more than anything. So that's why I'm here. So next slide here, and next slide. So what I want to talk to you first about before we get into like the real, meat of high fidelity simulation, just talk about medical simulation and just talk about just Wayne State and the dedication they have to medical education. Now, like I said, I started medical school 26 years ago. And the face of medical education has changed dramatically in that period of time, and for the better. And all along that time, Wayne State has been on that envelope, on the leading edge of that envelope, pushing it and staying current with the latest in medical education, and making sure that they graduate physicians that are up to speed in terms of practice and what the latest in the standard of care is. So in a nutshell, that's what we do here at Wayne State. We bring some of the advanced technology and medical education right to you. So medical education simply is basically training, medical simulation, is basically training anybody that's a healthcare provider, whether that's a physician, students, nurses, physicians, assistants, pharmacists, whoever. It involves taking that group of learners into a simulated environment where you have simulated human patients that are going to present to you in any way we choose to have them present to you with educational documents such as laboratory studies, ECGs, and then you need to take everything that you learn and in your clinical skills, course 1 and 2, your basic medical sciences, your pathophys, your pathophysiology, your skills of interviewing a patient. Then you need to synthesize all that into a differential diagnosis and treatment plan that you're going to execute. Next slide. Now, if you look at simulation in general, okay, not just in medicine, but simulation, when you think about what are the industries that really really push the envelope in terms of simulation. And the one that should probably come to you right off the bat is the airline industry or aerospace, right? They don't just let you grab the keys to the space shuttle and just, take it out for a spin before you do a lot of time in the simulator. And medicine is kind of on the is in the infancy of its involvement in simulation, and there's no better profession or arena that simulation is needed than in medicine. And the big thing is, the main purpose of simulation, and a lot of our simulators will have task training capabilities where you can put a tube in their throat, you can put an IV in, you can put a chest tube in, but the real value is the fact that you are allowed at any stage of your learning, whether it's third year, fourth year, as an intern, because we do this with residents as well, we can put you at the bedside of a patient and the proverbial buck stops with you. You don't have the safety net of a senior resident. You don't have the safety net of an attending physician. It's you and your colleagues, and your responsibility is to manage this patient, period. And let me tell you something, from being in that hot seat myself, there's nothing more motivational to learn and to go home and read than being at the bedside of somebody with advanced disease that may be decompensating or becoming unstable on you, and you're not sure what to do. It's kind of terrifying. I'm kind of getting sweaty palms just thinking about that. But that's the whole purpose here. The overall ability to put yourself in a situation where you are solely responsible for this individual and having to execute at that level without no harm coming to everybody. If we put you in the hospital at the bedside of a real person and let you do that, well, I'd probably be going to jail or at least lose my license. So the utility in high fidelity patient simulation is, in my opinion, though I am a little biased, is second to none. So like this slide says, the main one of the main thrusts is to improve patient safety and reduce error in all elements of patient treatment, right? Management, prescribing, surgical procedures, and general practice. Next slide. So simulation exists in all different forms, right? It's not just the high fidelity patient simulators that you see in some of our simulation labs. There's low fidelity simulation, there's hybrid simulations, and in fact, the American Board of Emergency Medicine, which Dr. DeWeert can also attest to, as he's my fellow emergency medicine physician as well. I'm sorry, I forgot to state that, yeah, although I started medical school 26 years ago, I'm emergency medicine trained and boarded, and I work in the emergency department at Detroit Receiving Hospital when I'm not teaching at the School of Medicine. So when you do your oral board exams in emergency medicine, you have these patient encounters. Now, since the pandemic, we have gone virtually, but pre-pandemic, you would go into this stuffy hotel room in Chicago, and you would take your oral board exams, and you would have these low fidelity kind of simulated scenarios that you would have to work through. So simulation exists in all types, low fidelity, high fidelity, and a hybrid thereof. And you will actually see some of that when you come here to Wayne State. Next slide. So the thing that makes simulators high fidelity, or what high fidelity medical simulation means, is they have realistic features, right? Their eyes blink, their pupils react. We have some simulators that have the second gen eyes that have sensors. So when you walk into the room and stand at the bedside, they'll blink and look at you, which tends to kind of cause unrest in people. I don't know if you had a bad experience with a doll as a kid or what, but it is a very cool thing, actually, if you ask me. They have pulses, they breathe, their chest rises and fall. We can make them cry, drool, vomit, urinate, you name it, we can make it happen. They also, like I mentioned earlier, have some task training or some procedural skills, like putting in chest tubes, intubating them. But again, the overall benefit and value of simulation is just the overall patient management that you're engaged in and having to juggle a lot of balls, or all those balls that entail patient care. Next slide. So the true art in the simulation is really a testament to those that design the simulators, right? You have the hardware, which is the actual mannequin, and then you have a software program that integrates human physiology, pathophysiology, pharmacokinetics, dynamics, disease process, and you get the finished product, which is somebody presenting in heart failure, having trouble breathing, decompensating, and you need to intervene. So we control that from the control room. You know, we have a two-way mirror, so we sit on one side We watch the scenario and the student intervention on the other side. We have cameras in the room, so if we'd want to record the intervention such that later, when we're doing debriefing, we can use that video for whatever purpose we're trying to teach you in terms of what your goals or objectives were. We can certainly do that. A big part of the learning is not only, being within, performing within the scenario and taking care of this patient, but immediately afterwards, you will be debriefed by the content expert in simulation. So if you're doing an emergency medicine simulation, somebody with chest pain, VFib arrest that you have to code, it'll be someone like myself or Dr. DeWert that will be debriefing you in terms of, this is how we manage these scenarios in the emergency department. Similarly, if you're using like our birthing simulator and you're doing a spontaneous vaginal delivery, you'll have one of our OBGYN physicians debrief you in terms of, the intricacies of spontaneous vaginal deliveries and what you need to be cognizant of. And if we want to record those and play back to you as part of the debrief learning process, we can do so as well. Next slide. So we do have 4 high fidelity simulation labs. Only 3 are shot here because the 4th one was being used for clinical skills. So it was not set up and ready to go. But moving from left to right here, we have iStan, which we have a little bit more about him. We have Apollo, which is right next door. And then across the hall from, or across the debrief or the control room from Stan, we have Lucina, which is our birthing simulator, which gives birth to a baby, which is also a simulator. Isn't that something? Irony. Go figure. Next slide. All right, so these are just some of our simulators. This is iStan, just with all his capabilities listed here. And for the sake of time, because I tend to be a little long-winded, I know my fault. Although I haven't let the bad jokes go too bad here. Next slide. Next slide. This is our PDSM. This is that was PD. PD is about a 7-8-year-old. So we have 2 types of, I saw a question earlier about any kind of pediatric simulator. So we have 2 types. We have PD here, who was about 7-8 years old. And then the next simulator we have our baby, our Laerdal Sim baby, which is about 10 months to a year old. And then lastly, our last simulator that we have, well, not our last, but the last one I have a slide of is Lucina. This is our birthing simulator that delivers a baby, which is also a simulator and can be put through the rigmaroles just like any of our high fidelity simulators. So the importance of simulation in medicine cannot be overstated. And you know that you're making an impact in medicine. You can go to the next slide. That was perfect timing. That was like, wow, you're right on with that. When what you do and the educational modality you choose to invest in and use to educate your student actually lands on Grey's Anatomy. So I'm gonna let you play this, and I'm just gonna sit back. I apologize for a little bit of the drama and storyline get in the way of the real simulation, but I can't help it. It's on YouTube. There's only so much I can do. But it's a brief, like 2-minute video. So just watch and enjoy.
The TV medical drama Grey's Anatomy, you see it every Thursday night here on ABC 40, has gained attention for putting real-world information and procedures in its episodes.
Well, tonight's episode of Grey's Anatomy features medical simulation technology.
The doctors at Seattle Grace are going to be using the latest form of a virtual patient. I love this. It's known as iStan, and this is Tish Palmadesi with a story.
Ladies and gentlemen, allow me to introduce Stan. State-of-the-art computerized patient simulator. Stan can educate you in airway management, trauma assessment, and care. He breathes, he pulsates, he seizes, he hemorrhages, he secretes, and he speaks. Hello, Stan.
Hello, doctor. I'm not feeling well.
Stan will tell you what he needs, and he's more forgiving than most patients. You kill him, he'll keep coming back for more. So make good use of him, people.
We're operating on robots now? Can we please go back to pigs?
What about people? When the chief decides which one of you gets to do the first solo surgery, you'll want to be ready.
Wait, did you just say
No, I
something?
wasn't sure when you decide that.
It's going to be
One of us?
soon.
And how is it not know what it will be. I do not know when it will be. I do know that the winner should be prepared to do any surgical procedure and will choose one intern to scrub in. So practice your skills and press your attendings and just do not make me look stupid. Gray, Stevens, you're with Han, Yang, Pitt, Karib, and O'Malley, your skills lab. today, so you can take turns getting to know.
Dead fine. I am having chest pain. My pain is getting worse. My pain
I hate
is
this.
getting worse.
I'm not gonna win the solo surgery practicing on plastic, man.
You're not gonna win the solo surgery because you suck.
Your bedside manner is what sucks.
What? What did you say?
Ain't technology amazing?
Screw this. I'm gonna practice medicine. You go ahead and play with your doll.
What's the matter? Scared of a little education?
You are so awesome. You are so awesome. No, stay. Come on.
I cannot help it. I'm dying.
I'm applying
There
pressure.
must be something you're forgetting.
Oh, for crying out loud!
I'm surprised you even passed your intern exam.
Oh my God.
I'm sorry, I couldn't resist.
Chief, I have to talk to you.
All right, that's it for the video. Pretty entertaining. I was pleasantly surprised when I saw that, but not to be outdone by Grey's Anatomy, because those are a bunch of actors pretending. Here are our own third-year medical students on their OB clerkship doing a spontaneous vaginal delivery case. As you can see, we have cameras pointed above the bed, kind of at the head of the bed, and one in the corner of the room to video record. We actually did use video debrief to debrief this crew. In the next slide. And then this is our year 4 students on their emergency medicine clerkship, participating in a chest pain cardiac arrest code that they are running. As you can see, it's a group of about 6 of them in there that are working as a team in a code situation to take care of this patient. And like I said, we have the ability to record and to debrief. And the feedback I always get is this is fantastic. So that is all I have for you here. There were some questions. I was trying to multitask and like do the presentation and read, and it took all I had to not fall over. But there was a couple of questions there. One was, do we do any kind of research and simulation? Actually, that's a good question. A few years back, there was a group of emergency medicine residents that wanted to do a study, and they developed like a little mini emergency medicine boot camp, and they looked at how video assisted debrief impacts performance versus just non-video assisted debrief. And we just actually submitted that paper and got it returned to do some corrections, and we're going to be resubmitting it. So yeah, that does happen as well. But I am going to stop there, and I know we have time for questions later. I want to thank you for allowing me the time to speak to you. It's always a pleasure to get in front of this wonderful group of people, and I look forward to seeing you guys schlepping around the hallways here in a few years. So all the best. Thanks for joining us. Take care.
Thank you, Dr. Dmitrievsky. I'm going to turn it over now to a couple of other people. First, I'd like to invite Kim McKissick to kind of speak with you all. Kim is one of our amazing standardized patients, and so I was hoping she could kind of give you all some insight into what it means to be a standardized patient and what it's like to work with our students.
Okay. Hello, everyone. Again, my name is Kim McKissick. I am one of about 40 or so standardized patients at the Clinical Skills Center. And I must say that I'm very proud to say that I've been a standardized patient at Wayne State University School of Medicine for about 15 years. That's a very long time. As a standardized patient, I provide our medical students with a very safe environment. I have to emphasize the word safe environment to develop and fine-tune their history-taking and physical exam skills when interacting with patients. I portray patients in a variety of scenarios, and this all starts about 2 weeks after our students arrive on campus. My goal and our collective goal at the Clinical Skills Center is to give our medical students experiences as close as possible to real-life patient encounters. One day, I might be a patient who is experiencing stabbing, horrible abdominal pains. On another given day, I might be a patient presenting with severe knee pain in both knees that is getting progressively worse. Our Clinical Skills Center has literally hundreds of patient scenarios. The emotions that the patients I portray have may range from being very, very pleasant and sweet and very cooperative to being extremely frightened, nervous, and sometimes downright angry. Students are provided with the opportunity to hone those skills necessary to effectively communicate with our patients and real life patients who are experiencing ranging emotions. And again, I have to say, this is all done in a safe, very, very safe learning environment. Our students also master the important skills of delivering bad news. Students practice doing head-to-toe physical exams on me along with the other standardized patients. As a standardized patient, I receive ongoing training and certification on how to do physical exams. Therefore, I am well equipped to provide guidance to students as necessary. Our medical students are deeply appreciative for the continuous constructive feedback that I always give following my encounters with them. And lastly, I'd like to say something on a personal note, that it is very, very gratifying to me as a standardized patient, as I watch these students when they begin their process, when they first get on campus, and I just watch them as they grow and develop confidence. And in fact, I ran into a resident, a young man, about 2 months ago at one of our local hospitals. My sister was in the hospital, and I was at the elevator, and this young man walked up to me and he thanked me. And I honestly did not remember him, but he had went through the program here at Wayne, and he was now a resident, and he thanked me, and he said he would never forget the impact that I had on his journey to becoming a doctor. Thank you.
Thank you so much, Kim. And I will say Kim is like probably the best standardized patient we have at giving feedback. I'm always so blown away by how thoughtful it is and how constructive. So she's really one of the best people we have working with us. But that's a tall order, because all the standardized patients are just phenomenal and really instrumental in the learning process. So thank you so much for being with us, Kim, to give us that kind of perspective.
Thank you.
The next people I'd like to invite to speak to are a few medical students who have come through the program. So I guess I will first have Layal, who's been so incredible at monitoring the chat and providing information for the attendees. Could you please introduce yourself, your current year, let us know what brought you to Wayne State, your undergrad experience, and then tell us a little bit about the Clinical Skills Center and your experience.
Sorry, I was like, as you were talking, I was also answering a question. So I'm Lael. I'm one of the fourth year med students. I'm applying OBGYN, so our applications go in about a month. I went to the University of Detroit Mercy for undergrad. I studied biochemistry, and I went straight through after I graduated. I'm sorry, this is the hospital. I'm here right now, so we're having some like patient calls, but I went to Wayne State because I'm from Michigan originally, and it was close to home. And I had already spent a lot of time working with the Detroit community, and I just absolutely loved it. It became like a second home for me. So that was a big part of kind of choosing where I wanted to go, was wanting to continue my involvement in this community. So Wayne State for me was a perfect pick. I was an early decision kid. This was the only place that I had applied because it was pretty solid on where I wanted to go. As for like the clinical skills experience, I think it is one of like the best like form of training that we get. And you can talk to a lot of residents in the hospitals here. They see a lot of students from other schools. And it is very apparent that we are all like within clinical skills, like very successful and very prepared, even from like your first rotations. You'll never personally feel that way, I think, like going in. I think the first time I like stepped in a hospital, I was like, shoot, I actually have to do this for real. You would be surprised. You know way more than you think you do, because all of those nerve-wracking sessions that you've gone through in clinical skills kind of prepare you for that. And especially from like day one, like yesterday, I was like grading students' oral presentations from clinical skills, and they did a really good job even for their first time. And so when you do it like 1,000 times before you step foot in the hospital, you get really, really good. And the opportunities that we get in the free clinics, like your sessions will prepare you for the free clinics. We had M1 students give physical exams for students in the Detroit public school community, and they had just done their MSK session, and they were doing like MSK parts of the physical exam on these patients in the real world. So it's definitely very applicable. I'm probably talking a lot, but there's a lot of really awesome things about clinical skills. And I say this because I'm also an advanced clinical skills trainer now, so I think this is one of like the best parts of like Wayne State's program. Um, so I can also answer questions about that later, but I'll let Alyssa also introduce herself.
Hi everyone, my name's Alyssa. I'm also a fourth year medical student. I grew up in Metro Detroit until I was about 14, and then I moved to San Diego with my family. I went to UCLA for undergrad, and I majored in molecular cell and developmental biology. And then I found myself back in Detroit afterwards for med school. So for me, I chose Wayne because there's so many different experiences from the clinical opportunities as well as the community service opportunities. And I think that having so many different experiences, both in the community and in the hospital, has really been able to impact my experience and my learning so positively. I did my rotations at the Detroit Medical Center and also at the VA. And a lot of our students are able to have a lot of different experiences at different hospital systems. And I think that that really prepares you really well in many different ways. So I really love that about Wayne. And I think Kado in particular, the training that you get regarding your clinical skills is so applicable to every situation. It really teaches you a framework and a mindset going into all of your clinical experiences. And no matter what it is, the tools are there. You just have to unpack them and learn how to go about those situations. So I really think that the judgment-free zone that Kim mentioned earlier was really important. It allows you to make mistakes and to learn from those mistakes with a lot of good constructive criticism from standardized patients, from other like a lot of other like students that are helping you and stuff like that. Because for me, I learned from making mistakes. I think most of us do, but there's a lot of constructive feedback that you'll get at so many steps along the way. And you're able to incorporate that feedback into future sessions and then into your rotations later on. Then you'll see in your third and fourth years that you're going to be doing physical exams and patient presentations every day. You're going to be learning every day. And just your growth is just like, I feel exponential from there. So I just really am thankful for this experience. I think that the administration does a really good job hearing feedback and being able to incorporate that. And I really see that the program has grown, like not just the time that I was there, but also like in the years following. So I would really recommend this program for sure. And now that like Lyall and I are looking to residency, a lot of my mentors have said that Wayne State students are known for having really good clinical skills and a really strong clinical background. So that gives me some comfort going into this application season. I'll be applying to pediatrics. So yeah, open to questions as well. Thank you.
All right, I think that concludes the portion of the session with speakers. So I think now it's time, Dawn, to transition to Q&A.
Yep. So we've been kind of tracking some of the questions, and I'll do my best to get through all of them. Looks like we have 13 minutes. So I know a frequent question on here, are the skills labs open for extra help? Are there certain hours that are maybe available?
Yeah, I can definitely speak to some of that. So there's not like an open door policy necessarily where you can come in and use the skill center, simply because we run so much programming here that you know, kind of time is of the essence, and making sure that everybody who needs to use the skill center has a chance to do that. But we do host enrichment sessions. So after particular sessions in the M1 curriculum, we have opportunities for you to sign up and practice skills either in small groups or with dedicated standardized patients. So if you want additional practice, we do make the skill center available kind of during structured times.
Lyall, I'm going to ask you a real quick one. You said MSK. What does that stand for?
Musculoskeletal system. I'm so sorry, that is not intuitive.
Yeah. So, is there an opportunity to have any kind of modules to go over a variety of verbal interactions we can encounter in a real scenario, be it elderly patients, children, non-English speaking? Are we taught how to conduct ourselves properly and use the proper terminology?
So I think that's actually built into the curriculum and beyond clinical skills. There's another course, the P4 course, which also kind of goes through certain communication techniques. We definitely build in basic empathetic communication and patient-centered communication in Clinical Skills 1. And then maybe Dr. DeWeert can speak to the special patient populations, which kind of anchor the different Clinical Skills 2 sessions to give you experience with those patient populations.
Yeah, throughout our 8 core sessions, 3 sessions are more focused on procedures. We work specifically on skills related to patient populations like people experiencing homelessness, people experiencing addiction, people with lack of resources. Let me think. That's what we focused on in the second year.
Thank you very much. There are a number of courses, and the one that Dr. Miller mentioned was population, patient, physician, and
Professionalism.
Yeah, the P4 course, which is in year 1 and year 2, and it spends a lot of time talking with you or teaching you how to become, a better communicator with different populations.
Food insecurity. That was another one I forgot about.
Food insecurity. Do students have a video copy of the debrief to review after the simulation session?
For high fidelity simulation, no, we usually do not. I mean, we certainly, as long as everybody else in your group is okay with you having it, I don't see why we couldn't give it to you if you really wanted to, but we normally do not provide you with like an actual copy to take home. We don't use it all the time. In fact, when we do use it, I get a big cringing and like, oh, I gotta look at myself on TV or video. But there are certain valuable times we use it. No one's ever asked me for it, but hey, if you want it and the rest of your colleagues that were in that simulated session with you are okay with you having it, we could probably get it to you. Absolutely. No problem. Another thing I want to just mention, it had to do with the question of, is the clinical skills available to me after hours? Like, can I just swipe in there at like 2 in the morning because I'm a night owl and I'd like to practice. And the reason that's hard to do is because when you do come to the clinical skill center, whether it's you're doing course 1, course 2, whether you're doing simulation, whatever you're doing, it's a very structured phenomenon that takes a lot of execution by the SPs, by staff, by faculty to make that a worthwhile endeavor for you. So because there's so many moving parts to get you what you need, that's why we can't offer it, 365, 24/7. The thing is though, as Dr. Miller alluded to, certainly your progress is monitored. And if you are having difficulty, it's not just a rubber stamp that everybody that walks through there gets passed. You're going to have to demonstrate some proficiency. And if you need more time or more assistance demonstrating that proficiency, you will certainly receive it. And then the language or the communication in medicine starts right off the bat. I remember being a first-year student in gross anatomy lab, and we were dissecting something, and I called over Dr. Mazarias was one of the professors there. You know Dr. Mazarias, Dawn. And I said, hey, Dr. Mazarias, I don't know what this thing is right here, right next to I don't know what this blood vessel. He's like, thing next to? I don't know what you're talking about, student doctor. When you learn the appropriate descriptive terms, come find me. So I had to find this vascular structure that looks like it has a tunica albuginea that is posterior to and inferior to what appears to be the renal artery. I'm not sure what that is. So, but that'll come with time. So anyway, it's like learning another language. It actually is. So, but anyway, to answer your question and a couple of more, I'm sorry.
Let's see here. For the students, what is your favorite involvement opportunity on campus that helped to develop your clinical physician skills?
I think my favorite one is SRFC. So that is the student run free clinic that we have, and you as a med student will have the opportunity from M1 to M4 to be part of a care team. So a care team will typically consist of an M1 and M2, and either an M3 or an M4, as well as one attending. So you will meet. So I'm doing that this week. So tomorrow night we will all meet beforehand. We open up our patient charts that are coming to clinic. So we run this whole clinic, and we'll go over patient charts, and we'll review differentials, what we want to change in their medications, what new prescriptions, what imaging we want. And we'll kind of discuss it as a team as why, because obviously as incoming M1s, you have experience, but not as much, which is why you're paired with senior students and an attending, and you'll all get to talk about these patients. And then that following Saturday, when you come in, you will do physical exams, you will collect a history, you will edit their actual chart. So it's like a normal EMR system. And you will get patient prescriptions. You can draw blood. If you know how to do phlebotomy, you can help out with that. I did a Pap smear last week on a patient because I've learned how to do that here in the hospitals and from clinical skills. So I was able to do that on a patient who hadn't had a Pap smear done in 6 years. And then you kind of send them on their way, and you set up like a follow-up appointment. And I think for as scary as that is when you're there in M1, and you're like, the attending pushed me in and was like, all right, go ahead and get a history. And I was like, I just started clinical skills last week. It's okay because you have support. They will fill in the blanks for the mistakes that you make or the things you forget to ask. And you will get so much better at it that you'll be almost like super prepared if you like keep going. So that was one of my favorite ones. And it's like nice to be in like a full circle moment where I went from like not knowing anything to like now being like supervisor of a care team. And like helping make those plans myself, which is just like, it's just very fulfilling and nice to see like how far you've come.
One thing I'll add, I think someone asked if these opportunities are available to all students, and yes, they are. Every week there is a newsletter that goes out with all of the volunteer opportunities that are available. So every student has the opportunity to sign up for this from M1 to M4. So that's an opportunity that will always be there for you. I was also involved with the CHIP clinic, which is Community Homeless Interprofessional Program. And this program, like the name says, it's interprofessional. And I thought that was kind of interesting because we had students from medicine, physical therapy, law, pharmacy, and social work. And it was really interesting to see. And along with students from all of these disciplines, there were also doctors and other people from these specialties to give patients like support from all aspects of their life. So I think that's also something really cool that Wayne offers. And it's also integrated into our curriculum later on, where you'll have projects with students from other disciplines to see how those things can be incorporated into the clinical world as well.
So we still have a lot of questions. We obviously won't get to all of them. Many of them cover topics that are not necessarily relevant to Kado clinical skills. So we will try to answer them and include them with the presentation when we send it out. A lot of the questions you're asking are covered in other courses and the other parts of curriculum at Wayne State, not just this particular portion. So I thought, we'll finish with Kim and then Dr. DeWert, and then Dr. Miller can close us out. So Kim, any last minute thoughts?
Well, only thing I can say is I like to just emphasize how safe it is at our clinical skills center. It's just a place where you can make mistakes. We are designed for you to practice and make mistakes on us, the standardized patient. Then when you go out and work with real patients, you have much more confidence and you have tools to pull from to make your encounter with real patients more successful.
Yep, that didn't work.
I'm sorry, can you repeat that question? I was typing an answer. I'm so sorry.
That's okay. Any last minute thoughts you want to share?
Yeah, thanks all for attending. You're at a really exciting time. I think Wayne State has a lot to offer in the clinical skills department. We have great community of the Kado staff, the guest faculty, the standardized patients, the M4s teaching. We have a lot of fun. We get you guys ready for clerkships, and I just think it's a very safe, supportive environment. Thanks for your time.
Dr. Miller?
Yeah, before I just kind of bring it on home, I want to respond to a lot of the questions about kind of scoring and pass fail. So everything here is pass fail by design because we want to take the emphasis off, oh, I lost my light, attaining a specific score. And really the focus should be on learning and growing your skills every time you come in. So that's why everything is pass fail. We expect you to participate. We expect you to do your best. We'll provide you with support if you need it in order to advance in your skills. But we really believe in making sure that your motivation comes from learning how to take excellent care of patients and not just from getting a gold star on your transcript, even though it's hard as a medical student to unlearn that way of thinking. And then I'll just kind of conclude how I opened by telling you that I really think that the Clinical Skills Center is this really special place at this really special medical school, which is focused on providing equitable care to all patients. And it gives you just an incredible foundation and training for the rest of your career. So I really look forward to working with you all if you are able to choose to come here and train at Wayne State.
Thank you.